and welcome to Talking About It, a podcast from New Canaan, Connecticut. I'm your host, Cindy Graziano.
COVID is transforming every aspect of our lives in ways we could have never expected. How can we adapt in healthy ways? This year, the New Canaan Abuse Prevention Partnership is dedicating its Talking About It podcast to providing practical tips to manage the stresses of living in this difficult time. The psychological and physical health of everyone is at stake. And one critical takeaway from life during the COVID pandemic is that we must learn new skills to better take care of ourselves and one another. Our goal is to create an educational and open dialogue within the New Canaan community and beyond. May is Mental Health Awareness Month, so how fitting that in today's podcast, our guest is Dr. Andrew Gerber. Dr. Gerber is President and Medical Director of Silver Hill Hospital in New Canaan, Connecticut. People have said that Dr. Gerber makes mental health cool. His medical degree is from Harvard Medical School. He has a PhD in psychology as well. His undergraduate degree in physics is from Yale University. He remains on the faculty at Columbia as well as the Yale Child Study Center. Prior to joining Silver Hill in November of 2018, he was the medical director and CEO of the Austin Riggs Center in Stockbridge, Massachusetts. In the last several years, he has opened the door of Silver Hill's extraordinary resources to the people of New Canaan. Welcome, Dr. Gerber.
Thank you, Cindy. Thanks for having me.
It is our pleasure. I think a good place for us to start our discussion is just around the language that we use in mental illness and mental health. How do you define mental illness today?
So I think it's such an important question you're raising, Cindy. I think in many areas of science and medicine, we use very specialized language. And while that can be off-putting in some ways, it also helps the field define its terms well. In the field of psychiatry and psychology and mental illness, we think it's very important to use language that is accessible to people. However, there's a danger with that, which is we can speak about things that mean one thing to a professional and mean something different for someone who's not a professional, and that can lead to a lot of confusion. So I love that you're starting with this basic question. I think it's important that when we talk about struggles with mental illness, we start really by describing the experience of the individual, because that tells us not only about what they're saying to us, and it encourages us to listen to patients directly, but it also makes us remember that at this stage in the field, we really categorize different difficulties, whether they be depression or anxiety, or even to some extent more severe illnesses like psychosis or mania. We're describing a set of symptoms. We would love to be at the point in the field where we were describing the underlying problem in the brain. But frankly, the brain is such a complicated organ that we don't yet have the language to do that. So for example, I often make the analogy that when we talk about someone having an appendicitis, we're not saying they have belly pain, because we all know there's many reasons for pain in one's abdomen. But an appendicitis is a very specific reason for abdominal pain that is different, for example, than gastroenteritis, or, for example, some other kind of illness that might cause abdominal pain. At this point, we're still describing symptoms. At times, we now switch into a language where we're talking about what do we think is causing those underlying symptoms. Why is a person depressed? Why are they anxious? And so on. And as we have the conversation today, I'll point out when I'm switching from one to the other.
It seems that there is so much more talk about mental illness today. Everybody seems to be talking about it. Is there a trend that there is more mental illness today, or do we just have better ways of describing the symptoms or the causes?
I think the answer is both. There's no question that we are getting better at describing these things, and this is one of the silver linings, one might say, of the last several years, is that for a number of reasons, I think people have gotten more comfortable talking about their own or their family's mental illness. So part of this increased sense of the prevalence of mental illness is indeed, I think, an increased openness to conversation. Some of that's been driven, for example, by celebrities and athletes and leaders who are talking about this in a way that would have been unthinkable 20 or 30 years ago. But there's no question that that's not the entire story. There's good data now from back in pre-2020 and post the pandemic to show that the reports of symptoms of mental illness have gone up significantly in almost every area of society. The most dramatic is in adolescents and young adults. And it seems like no coincidence that in those children and adolescents whose lives were most disrupted by COVID back in 2020 all the way through now, there are increased reports of depression and anxiety. And then in the homes, that is parents and adults who are living with younger people also report higher levels of mental health symptoms. We can obviously speculate about why these have been such stressful years. Some of that is no doubt due to the direct effects of isolation and masking and the direct effects of COVID. But we believe it's not only that. It's very hard to show this with the data, but we believe that things going on more widely in society, some of the divisions in society, have also led to some of the symptoms that we're seeing.
It probably is a question that takes us down an entire path, but is it obvious that social media has impacted that age bracket to the point that it has increased isolation or caused more self-doubt and all of those things? Is that obvious? And what do we do about that?
Yeah. You know, in science, you might say nothing is ever obvious, right? There have been times that we have assumed things that only later look back on and said we were wrong about. But I do think that the impact of social media on mental illness is probably one of the more clear relationships in recent times. The challenge, of course, is to know, well, how much is the actual social media itself, and how much is all the stuff that comes with it going on in society. We can't separate those because this was an experiment done on a massive scale, essentially with all of us, certainly all of our young people. That said, the folks who have been researching this are fairly convinced that there are specific effects around social media that we can point to. So I'll give you probably the most obvious one. And you've heard many parents say this, but never in the history of technology have young people had as much access to direct comparisons between themselves and an idealized image of others. Remember, what they're seeing on social media is not necessarily an accurate vision of what everybody else is doing in terms of their social lives or their appearance or their successes. But young people now are spending an increasing number of hours feeling inadequate in relation to what they're seeing on social media. And that clearly has a negative effect on self-esteem, and it has a negative effect on one's ability to consolidate what I would call a balanced and nuanced identity, right? Part of maturity, part of adulthood is being able to describe oneself as a complex person who has strengths, who has vulnerabilities, who's good at some things, not so good at others, and finds a way in the world, both building on one's strengths, but also acknowledging the things one is less good at. That's harder to do in a society when one is constantly comparing oneself and being encouraged to portray oneself in ways that are more superficial.
Well, and it goes to the epidemic of loneliness that has been talked about so much. So I'm wondering, does mental illness, the vulnerability around mental illness, cause loneliness? Or because people are feeling disassociated, that's causing mental illness? Is it that clearly defined?
Yeah. I mean, I think that in many ways, and it follows directly on what we were just talking about, loneliness is a cause of mental illness, probably more than the reverse, meaning that as we as a society get more fractured for a variety of reasons, one is increasingly focused narrowly on oneself and has a less nuanced view of the wider community. And whether we call that loneliness or we call that isolation or we call that fracturing or division within society, we believe that has a direct causal relationship. That causes some of the other problems, particularly anxiety and depression. Now, there's no question that individuals who are anxious and depressed have a harder time than interacting more broadly, and it can also feed back in terms of a vicious cycle leading to further loneliness. So I wouldn't discount that piece, but I think what's changed really, I mean, that's always been true about depression and anxiety. What's changed in society is I think the way that our structures are really set up to create that isolation from the beginning.
Perhaps we can talk a little bit about the signs of mental illness for families and the community at large, but what are some of the signs that point toward perhaps a more serious problem than just having a bad day?
Right. It's important because this goes back to this language question, right? So much of our daily language is about mental states. And so when you come home from work, you say, oh, I'm feeling depressed today, or I'm feeling so anxious about this meeting I have tomorrow. One is not necessarily using those words to suggest I have a mental illness. And we wouldn't want to try to constrain people's language. In fact, I think the fact that mental language has come into much more wide usage is not necessarily a bad thing, as it expresses people's feelings in positive ways. But I would very clearly distinguish those sorts of daily life descriptions, the sort of normality of one's daily ups and downs, from where one is entering what I would sort of think is a disordered or pathological state, really defined by the lack of the ability to move forward in one's life. That is, a normal up and down is quote unquote normal because you can rebound from it, because tomorrow is a better day or can be a better day. Or even if it's more prolonged and one has something very sad happen, there's a loss in one's family or a disappointment in one's life, I don't expect that to only take one day of sadness, but if it takes a few weeks or even a month or two, the fact that one can then ultimately rebound and point to positive steps one is taking to get back on track is all what I would consider part of the normal spectrum. Where it starts to take on the cast of illness is when things don't rebound, or, and often these two things go together, it turns into a vicious cycle. Imagine the situation where when somebody is feeling down because of, let's say, loss of a job, and that doesn't lead to the ability to rely on one's friends or family, or apply for new jobs, or to think about one's career. All of those would be positive moves, but instead leads to one staying at home, drinking more heavily, not getting out of bed, becoming more and more depressed to the point that applying for a job becomes impossible. That's where we would start to think about it being an illness. And throughout psychiatry, we think of illness as tied to loss of function. Function can sound like a clinical term at times, but what we really mean is that people pursue the lives that they want to have. And if they feel like they can no longer do that, at that point we think getting some sort of professional intervention is worthwhile.
As it relates to that great example, that's true for adolescents as well, obviously, a teenager who doesn't want to go to school or becomes isolated from friends. But I'd like to explore with you what you mentioned, a few weeks or a few months. At what point does a parent or a family unit begin to say, this is more serious? They're going to school, but they're not engaging. At what point does a parent begin to get concerned and need a professional opinion?
Well, you're absolutely right to point to adolescence as one of the more complicated situations, because in some respects, Adolescence is defined by ups and downs. There's no parent of an adolescent, or no one who's ever been an adolescent, who can't point to ways in which, as part of normal, healthy adolescent function, there are ups and downs. And of course, adolescence lasts years. So one could say, well, does that mean an extended period of years of being anxious or depressed could be quote unquote normal? And I think what I would answer is that adolescence does cause us to change our lens slightly, meaning a certain amount of volatility, a certain amount of uncertainty, of exploration is absolutely normal. But it's in the service of healthy development, meaning for adolescents, those ups and downs lead to a sense of this is what I'm learning, this is who I'm connecting with. And there's a return to relationships, a return to a quest for meaning and identity, which is in some sense the essence of development. If it's not leading to those things, if the turmoil of adolescence seems to be heading in the wrong direction, meaning greater isolation, less function, less of a sense of purpose and self, then adolescence could easily be on the wrong track. And that's the point at which I would tell parents to intervene. I also try to suggest to parents that they need to trust their instincts. We were all adolescents. We've all seen adolescents. We have a sense of when things are tricky but going okay. And when parents no longer feel that, they feel that they really have lost their relationship with their adolescent, that their adolescent isn't pursuing the things that would make him or her ultimately learn from their experiences, then I would encourage the parents to ask for help. I see as relatively little downside to that. Even if the answer was your adolescent boy or girl goes and sees a therapist for a couple times, gets an assessment, and they say, you know what, they seem to be doing okay. To me, there's very little harm done. I would much rather people err on the side of asking for help than taking the risk of saying, well, I don't want to overreact, I better not do anything, they'll be upset, and then unfortunately not intervening before things get worse.
Right. Well, there's certainly an impact to families with mental illness or any of these depressions or anxiety. There's impact to families. And I think what you're pointing out is that there is hope and there are opportunities. I wonder if you could talk a little bit about abuse and trauma and how that impacts mental health. This is part of the new Canaan Abuse Prevention Partnership. So can you talk a little bit about the trauma and abuse and how that impacts mental health?
Absolutely. You know, I think one of the things we've learned a lot more about over the last several decades is how universal, in some respects in society, trauma is in a very tragic way, in a way that many of us, or I would say most of us, have never necessarily wanted to admit. And if you go back a certain number of decades, when people not only didn't talk about mental illness, but they didn't talk about the rates of trauma in the world. Even when it was one could look around and see war and famine and really, I think, conclude that what we could see was significant, so probably what we couldn't see was even worse. And I mean sexual trauma, I mean domestic or intimate partner violence, I mean child abuse, I mean elder abuse, I mean things that were going on behind closed doors, presumably throughout most of human history, but weren't getting talked about. And I do think that there is a good step in recognizing it. But it's also a painful step because by acknowledging how common trauma is, that now calls on us to do something about it. And certainly in the course of my career, I've seen the medical field take on way more responsibility for identifying trauma in our patients, in ourselves, in our families, and then coming up with systems that don't just paper that over, but actually intervene in ways that decrease the levels. So for me, the Abuse Alliance is so crucial in calling out that trauma doesn't only happen in other people's communities, it happens in every community. Now, let me add another piece to this, because I think this can sometimes be a reason that people avoid a conversation or maybe get a little stuck. Being a victim of abuse or trauma doesn't mean that you started off with a mental illness. And there's a real danger, I think, in pathologizing victimhood, because then the danger becomes that somebody, it actually gets turned around. And the person who is the victim of trauma is now being blamed and said, well, it must have had something to do with your pre-existing condition. Now, they might have had some pre-existing condition, but that's not really relevant in many ways to the fact that the trauma that was done to them came after that. And then we certainly know that victims of trauma are more likely to subsequently develop symptoms because of the trauma that they experienced. So I say this because in many ways I want to separate what we need to do as a society in reducing the rates of abuse and trauma from the existence of underlying mental illness. In one case, it's very clear what we need to do. We need to set up systems to prevent that abuse from happening. In the other case, we need to take a wider view of all the different illness that is in society, and some of that's in victims, some of that's in perpetrators, some of that's in neither, and get all of those people the appropriate care. So I think these conversations are important to have, and I think we really need multiple systems to handle all these problems.
And it goes a little bit to what you said as well. The stigma of mental illness is now trying to be mitigated. But I'm wondering, how is trauma defined?
It's a great question, and sometimes in my field people even separate trauma into two terms: trauma with a little t and trauma with a big T. I'm not sure we have to parse it quite that way today, but I would say that trauma is really defined by the person experiencing what to them feels like a life-threatening event.
Okay.
And truthfully, what an outside observer sees it to be is less important. What matters is the individual experiencing it. Because what is trauma as a child, what's trauma as an adolescent, what's trauma as an adult, may be different. And from an external point of view, one may look and say, well, that wasn't life-threatening, or that was life-threatening. And the truth is, it doesn't matter. What matters is what the individual, him or herself, was experiencing.
Which is a great way to look at that, because one of the things we want to talk a little bit about is how do you get to a point where you reach out? If you believe it's trauma or some form of mental illness, as you're saying, you get stuck, how do you begin to reach out?
Yeah, it's such an important question, and it has such an individual answer, because different individuals have different obstacles. Obviously, we wish we lived in a society and if people felt always free as soon as a traumatic event occurred, or there was even a risk of a traumatic event, to speak up and say, this happened to me, and to be believed, heard, and protected by the rest of society. That's where we want to get. What we know is that for many individuals, that's very hard to do. And it's hard to do for a number of reasons. It can be hard to do because they're afraid for their safety, that if they were to speak up, they're afraid it would make the trauma worse. That's a very common one, and very, very scary, because it can lead to cycles where one remains in a dangerous situation for a long time. One cannot speak up because one has been told, whether it's by one's perpetrator or somebody else, that they're at fault, and that they, for whatever reason that may sound completely illogical on the outside, is felt to be true to the individual, that they somehow deserve to be treated in this way. A horrible thing to imagine, yet it's something we hear from individuals who are traumatized. They can be helpless. They can feel like there's nothing anybody can do. The victim can sometimes feel dependent on the very same person who is causing the trauma to them. And that can be dependency financially, it can be emotionally. People say, how could you ever love somebody who does this to you. But the truth is, we can. And our minds work in very complicated ways. And you can both have loving feelings towards someone who's also treating you really terribly. So all of these things in individual cases can lead to a person not speaking up. You mentioned stigma, that's universal. And again, it leads to a kind of self-criticism about talking about things. To put it all together, though, what I would say is we need to meet people where they're at. And that means somebody, and whether that's a trained clinician or that's somebody in a position of answering a hotline or being a facilitator of some kind, needs to be able to hear where that person is and offer them the support that is appropriate to where they are. And sometimes that may just be listening and not asking them to do anything further. It may be giving them a phone number and having that phone number be something they can come back to when they're ready to call it, not even necessarily call right away. It may mean they're further along and able to go and see somebody or change their situation or work with somebody who can help protect them. But these are each defined stages. And as helpers, our job is not to judge, is not to decide for them what they need, but really to make resources available and to be ready to listen and hear what they need.
And I think those are great strategies because, as you say, the idea that someone is struggling, there are options, but many people will reach out to someone, even a neighbor or a friend. And so the idea of listening and meeting them where they are and having resources available to them is one thing we can all do. Is mental illness curable?
I certainly believe and hope that we can dial back these recent increases, that we can shift the trajectory that we've had over the last several years towards reducing the rates of mental illness and reducing some of the negative outcomes, certainly substance use disorders, depression, anxiety, suicidality, etc. Do I ever think we will eradicate mental illness from society? No. I think it is part of the human condition. But for individuals, I absolutely see that we can turn that corner and turn difficult experiences and even what I would call vulnerabilities into strengths. There's almost no vulnerability in the human character that doesn't also have an aspect of it, a flip side of it, that contains a strength. That takes work, that takes help from others, that takes being part of a community. It takes time. It certainly takes courage. But I believe that the experience of the individual in doing that is maybe not technically a cure, but in some ways you might even say it's better than a cure, because you're turning what was once something very difficult or even something shameful into something one can be proud of and something one can certainly overcome.
And that growth, that ability to see growth and improvement, if you will, or increased health can be very motivating for individuals too.
Correct. You've probably heard the old, and I hope I don't get the ethnicity wrong, but I believe it's a Japanese art form of taking a cracked pot and then repairing it and having it be more beautiful and stronger than it was before. And I think that's very true about the human character. I've met so many people in my career who have overcome very difficult things, including mental illness and substance use disorders, who are remarkable people and who in some way wouldn't go back and change what happened to them because it's made them who they are.
And just as you're saying, talking about those things, that people can get better, if you will, can look at their vulnerability and see some strength, and it is so inspiring. Obviously, the New Canaan Community Behavioral Health Resources and the programs that have been promoted is certainly one avenue for people to take. It's particularly important now based on the fact that we've talked about the increase in mental illness and some of the vulnerabilities. Can you address a little bit about what is available in the behavioral health programs here?
Sure. So first of all, I can't tell you how fortunate I feel I am as a president medical director of a psychiatric hospital, and Silver Hill as an institution is, to be in a community like New Canaan. If you go back in history, certainly 100 years or more, the norm was for psychiatric hospitals to be banished, to be out in some very remote area with often the stated wish of out of sight and out of mind. And to me, one of the inspirations of 92 years ago, when John Millett and then William Terhune and Elvira Parsons coming to New Canaan to establish Silver Hill, was the exact opposite. They said, we want to be part of a community. It was not a coincidence that they ended up just a couple miles from the center of town in a community that was already thriving and known to be a welcoming place. They believe, and I still believe, that being part of a larger community is good for the work we do. It's good for the patients who come and live at Silver Hill, and it's good for the community because it, to some extent, exposes everybody to the aspect of human existence and encourages us to talk to one another. Now, over the years, I think that's gone a little up and down. There have been times when Silver Hill has felt a little more remote. But one of the privileges of my tenure over the last 4.5 years has been to really reintroduce Silver Hill to New Canaan and New Canaan to Silver Hill. In a way, COVID helped with that. But even if it hadn't been for COVID, it was something that I really believed in. So this is a bit of a long intro into saying that only a little over a year ago, when the town of New Canaan, really led by Kevin Moynihan, our first selectman, and Bethany Zero, our Director of Human Services, as well as the Director of our Community Foundation, Lauren Patterson, and others, approached me and said, we can do something together. I thought that was just a real extraordinary opportunity. And out of that, or those conversations, we did two things that are linked. One is we built a New Canaan Behavioral Health Alliance, or you might even say we reinvigorated because it had existed before, but a group of people who come together regularly from all the different agencies in town, and now we've included neighboring towns in Fairfield County. So we have folks coming from Wilton and from Ridgefield and from Westport and Weston and Darien, and people come together and talk about what we're all doing and how we can better coordinate our services. So that's the larger organization. But more specifically within that, the town of New Canaan designated some public funds from ARPA to support a free assessment service. So any member of the New Canaan community can call a number, an easy number, or go to a website, and within 48 hours have a free and confidential assessment done by expert clinicians, including a psychiatrist, who's also trained as a child and adolescent psychiatrist, as well as an expert social worker. And we've been doing those since July of 2022. We just recently crossed the 100 mark, and we're really proud that these very comprehensive, quick, free assessments are supporting people's mental health. Our goal for the coming year, as we head towards year 2, is to include other towns as well. New Canaan continues to be a crucial support, but we have recently gotten a commitment from the town of Weston to join as well. We hope other towns will consider joining. And we really see this as a model for a service that is going to make mental health assessment and treatment more accessible to more people. Clear away some of those old obstacles that you'd have to have a copay or a deductible, or you'd have to wait a long time. We clear all those things away and say, come, and let's figure out what's going on, and let's figure out how we can be helpful to you.
And it's obviously been very successful. Were you surprised by the success?
I'm not surprised by the demand, because this is my job. Every day I talk to people, or people call me, and we hear about the difficulties. What I'll say that I am delighted by, surprised would probably be too strong a term, but delighted by, is the warm and open reception we've received from every different part of the New Canaan community. And when I tell you that churches and synagogues and men's groups and women's groups and schools have all reached out to us, not with fear, not with, well, we don't have that problem, but universally welcoming us in and saying, yeah, we need this. Even to the point of people standing up in meetings and saying, I went and got an assessment and it was helpful to me. That blows me away, because that suggests to me that this is a real community that is open for change and willing to have these tough conversations about what we need to do to move forward.
And certainly, as we said at the beginning, talking about it, having open conversations is certainly one of the critical runways to having some real impact on this issue. So in closing, I wondered if there was just one lesson you would like to leave us with, something that you think is a really important statement about mental illness, mental health, and the well-being of our community.
If I had to boil it down, and certainly these are complex issues, so probably can't be easily, but if I had to boil it down, I would say that human beings are looking for meaning and connection. And the best way I know to get meaning and connection is to be part of a broader community. Communities have to be the right size. They can't be too enormous or one gets lost. They can't be too small or one gets doesn't have enough options. And I believe that the New Canaan community is pretty much the perfect size to create a welcoming group of people who can disagree, can support each other, can keep things private, but can also share, and ultimately can increase this sense of connection and meaning. So that's good for all of us, and I think we have to work at it. It's not always easy, but it's a real privilege at Silver Hill to be part of such a great community.
Well, and we thank you so much for all your work there and all the efforts that everyone on staff does at Silver Hill. And I think the idea that there are options, that you can, if you're struggling, there are options, you can reach out, and seeing others who are struggling, you have options too, by that listening ear or offering a resource is a good piece of information for all of us to keep in mind. So we want to thank you, Dr. Gerber, for your time and for all your efforts, and we look forward to hearing more about all the services available.
Thanks so much for having me, Cindy.
Talking About It is a community production from New Canaan, Connecticut, created by the New Canaan Abuse Prevention Partnership, D.D. Bartlett founder, and produced by Robert Doran. It is supported by the New Canaan Community Foundation and many other organizations. If you or someone you suspect is in crisis, call the National Domestic Violence Hotline at 1-800-799-7233 or the Suicide Prevention Hotline at 1-800-273-8255. The National Suicide Prevention Lifeline is available at 988. To learn more about the subject we discussed today and resources on all our podcasts, please visit our website at talkingaboutit.org. We'll be back soon with a new episode of Talking About It.